Thank you all for being here. I especially want to thank Secretary Azar and Secretary Acosta. They're doing a fantastic job for everything they're doing with respect to healthcare and more affordable healthcare at that for the American people. It's incredible some of the things we've come up with that are much less expensive than Obamacare and in many respects are much, much better. People have to know about the options. We have a lot of options and people have to know about that. We're here today, though, to discuss how the healthcare system too often harms people with unfair surprises. They have some really surprises in a very negative sense, medical bills and the like. The pricing is hurting patients, and we've stopped a lot of it, and we're going to stop all of it, and it's very important to me. My administration is committed to delivering a healthcare system that takes care of American people, and like they haven't been taken care of before. And we can do that. It's a very difficult subject. It's a very complex subject, but we've all got to understand it very well. And the strides we've made are rather amazing. We want to take advantage of those strides now, and we want to let them be known to the American people as we make additional headway. We've already made that progress in a certain way. We're lowering, and we will continue to lower healthcare costs. We approved a record number of generic drugs over the past 2 years. If you look at what we've done, and we're going to be putting out a list at the end of the week, the number of generic drugs, which brings down the pricing, they're just as good as the name drug. In fact, one of the things that amazed me, I was asking a few of the people, including Scott, I was saying that what's the difference between a generic and a big name drug where you pay much more money? And they said, absolutely no difference. Do you still agree with that? I mean, Secretary, absolutely. So somebody's going to have to explain, why are they paying for the brand? Will somebody explain that, please? Because they literally say there's absolutely no difference, identical. And you'll pay 4, 5, 6 times more money for something that comes in a container that you're more familiar with. So we've expanded that greatly, a lot of generic drugs. Through the association health plans, thank you, Secretary Acosta, we've expanded access to affordable, high-quality health care, particularly for employees of small businesses and self-employed individuals. And we reduced average premiums on the federal Obamacare exchanges for the first time in the history of the horrible Obamacare. Okay, it's the first time it's ever happened. We're working very hard to get the pricing down as we really do things that are going to make it much better, and ultimately it will result probably in the court case termination, and we'll all get together and we'll come up with real health care. As a result of our efforts, prescription drug prices have declined in 2018 for the first time in over 50 years. So prescription drug pricing has been very important to me. Think of that statement. For the first time in over 50 years, it's gone down in pricing. Is that a correct statement? Because if it's not, they're going to get us, okay? They'll be looking very strongly. So we have to realize that that's a very, very powerful statement. First time in over 50 years that prescription drug prices have declined. That's in 2018. But the seen and unseen costs of healthcare are still taking an enormous toll on millions of American families. And this is something that I inherited. Unfortunately, you inherited it also. The people inherited. And we're doing a lot about it. Half of all unpaid bills on consumer credit reports in America are for medical bills. 1/5 of credit reports include a past due medical bill. And you think of so many other bills, but 1/5, a big portion of what people are having trouble with right now are medical bills, and we're doing a lot about that. Nearly 40% of insured adults report receiving a surprise medical bill in the last year. Patients should know that the real price and what's going on with the real prices of procedures, because they don't know. They go in, they have a procedure, and then all of a sudden, they can't afford it. They had no idea it was so bad. Of procedures, treatments, and medicines before they receive them. And this is a big shock to a lot of people, patients and others. When you go to a grocery store or you go to see a mechanic, you know the prices up front, and you get a receipt that shows the cost of every item, every single item. You know exactly what you're paying. You don't get your car fixed and you say how much. But people don't do that with the medical to the same extent, and they get some very unpleasant surprises. And one of the things that happens is when you don't make a deal up front, then the doctor or whoever it may be all of a sudden doubles and triples the price because they figure you don't care or you're rich, you have plenty of money, you don't have to worry about it. And we don't want that happening. That's what we want to do with healthcare so that patients will know exactly what the cost is, what the quality is, and just think of it as a consumer. You're really a consumer at a very high level, and you can get some great healthcare. We have some plans that are great, but you have to go in and price them. So I'd like to hear about some of the experiences of the people around the table. We've had some incredible experiences, some really eye-opening experiences, and we're going to hear that. But before we begin, maybe I'll ask Secretary Acosta to say a few words, and followed up, Mr. Secretary, by you. Okay? Thank you.
Mr. President, thank you. You mentioned association health plans, and I wanted to take this opportunity to update you on some of the preliminary results.
Okay.
You asked us, you ordered us to look at these to make them available where possible. And so far, we've had about 30 association health plans across the nation. We've had 2 that have gone across multiple states. And I wanted to highlight one in particular. An early adopter was the Las Vegas Metro Chamber of Commerce. And so they had an association health plan in the past. And so far, they're still processing, but they've had more than 500 employers and 100 sole proprietors sign up for this plan.
Right.
The plan provides quality. It's providing a substantial cost savings. For example, a small business where employees used to be paying about $450 per month for healthcare are now on average paying $230 per month. So a 40% reduction. And it's quality. It provides a 2-year rate lock. It provides and covers pre-existing conditions. Dental and vision are available. Health savings accounts are available. And this is the kind of quality that we're seeing in these plans across the nation.
And enough people don't know about it.
And people do not know about it, but you're seeing chambers of commerce from Massachusetts to Vermont to Nevada. You've seen the American Veterinary Association that just started a nationwide association health plan. Land of Lakes that is starting a multi-state health plan for farmers. And so as these are commencing, you're seeing incredible cost savings, and you're going to see many, many more of these.
And better healthcare.
And better health.
So you get better healthcare, much better healthcare at a lesser cost. So people just have to know about it, and it's available now. And are you doing the 401, or what are you doing with that?
So we're also taking the concept of association health plan and extending it to an association retirement plan, where right now 14% of small businesses and only 14% offer retirement savings to their employees. We wrote a rule, it's been out for notice and comment, that would extend the association concept so that these same organizations, whether a Chamber of Commerce or the American Veterinary Association, can offer 401k plans. So instead of every small business having a separate 401k, you can have large, centralized 401k plans. And not only does this eliminate paperwork, not only does it allow more employees to access retirement savings, but a small 401k's fees are much larger than a large 401k. And so you're looking at about a 1% fee saving per year with these association retirement plans. Right. 1% over a lifetime is incredibly meaningful to all of these employees.
Right.
And then finally, we're working on the reimbursement accounts, the health reimbursement arrangements, where employers can give their employees cash. So those employees can go out and they can buy their own health care. It provides more options, it provides more flexibility, and that's one project that I'm working with Secretary Azar on. It's out for notice and comment as well, and we're very excited about the possibilities.
When will you have all of your various plans out, would you say?
And so they're both out for notice and comment, and I would expect certainly the association retirement plan by spring.
Good. Okay, good. Thank you. Mr. Secretary?
Well, thank you, Mr. President, for welcoming us here today to discuss this really very important topic. Like all of the Trump administration, HHS knows the right way to bring down costs while improving quality in any area is to empower consumers and to employ market forces. this can't be accomplished without transparent pricing information. It's got to be meaningful price signals. But in healthcare, prices are often hidden, far out of line with what many patients will owe or both. Making prices more transparent can protect patients from the kinds of awful stories that we're going to hear about today and bring down costs for everybody in both healthcare services and prescription drugs. People should have the right to know what a service or a drug will cost them before they have to buy that service or drug. One key area is healthcare services. We've already started bringing transparency to healthcare, to hospital prices. Starting on January the 1st, hospitals are now required for the first time to post their list of sticker prices online in a machine-readable format, which is a historic first step in much bigger efforts around transparency. The data has to be machine-readable so that patients can use private sector solutions like apps that can help them understand this data. Ultimately, patients should know a service's price and the price that they're going to really pay, the out-of-pocket, before they agree to that service. Delivering that is a complex challenge, which we've put out multiple requests for information on how to make that a reality. And this is a problem not just for the folks who are visiting us from around the table. None of us are immune, myself included. Several years ago, my doctor wanted me to get a relatively routine diagnostic test. He then sent me within his complex from his office over to the hospital unit of this facility, where, because I had a high deductible plan, I asked how much it would cost. Do you know what I was told? We can't tell you. Well, because I was a former deputy secretary of HHS, I pushed and pushed, and I said, you're going to tell me what this is going to cost. And eventually they told me, $5,500. Well, I went on my phone and I quickly checked a very reliable healthcare site run by an insurance plan and said, if this very basic diagnostic were done in a doctor's office, not in the hospital, it should cost $550. And I said, okay, so $5,500. How much with my insurance company is the negotiated discount? What will I pay given my insurance company? We can't tell you. What do you mean you can't tell me? And I fought, and eventually they told me $3,500. So, armed with that information, I took the plastic wristband off and walked out of the facility and didn't get the test done. But we have a right to know this information. We have a right to be demanding customers, because if that happens, we have a right to take that plastic wristband off and walk out of that facility and not get a surprise bill when we get home months later. Many individuals, like the horrific stories we're going to hear today, who cannot afford those types of bills. And we know that employers and insurers who pair price transparency with incentives have driven costs down. This works. In one study, costs for imaging, like what I was going to have, were driven down almost 20%, while price disparities across providers also narrowed. Another key area that the President mentioned for transparency is around prescription drugs. And the President has put forth the first ever proposal to require disclosing the list prices of drugs in TV ads. Many patients pay based on their prices in deductibles or co-insurance based off of the list price of these drugs, and they've got a right to know that information. And earlier this year, the President put out a regulation and then signed legislation banning gag clauses that prevent your pharmacist from telling you if you can get a drug at a lower cost by simply paying out of pocket for that drug than by using your insurance. One study suggested that 23% of patients are paying more in copays than at the pharmacy than they would if they simply paid cash, and the President and Congress delivered that relief and transparency to America's patients. We also are concerned about the issue of rebates. And Mr. President, you asked about the issue of why would anyone ever take a branded drug when there's a generic available? One of the most common reasons is because a pharmacy benefit manager is getting a rebate payment from that branded company to steer you to use the branded drug rather than the much, much, much lower cost generic. We're concerned that patients and payers are left in the dark about the hundreds of billions of dollars in rebates being paid from drug manufacturers to pharmacy benefit managers or so-called middlemen. These payments are non-transparent and they distort these prices and create bad incentives in our system. Marty McCary, whom we have here today, has done remarkable work showing how neither patients nor employers who pay for insurance know what's going on with these rebates and prices. Bringing down prices in healthcare, as this President has promised to do, ultimately has to involve making sure everybody knows and understands these prices, they're transparent, and they're available. Thank you very much.
Well, thank you very much, and thanks for the great job. And remember, as we get ready to leave the media, prescription drug prices in 2018 went down for the first time in over 50 years. And that's not by accident, that's because we did a lot of hard work, and it's going to continue to go down. And we're finally getting drug prices down for the American people. And this was a one-way street up. And now for the first time in over 50 years, prescription drug prices have gone down. So we're very proud of that. Thank you very much, I appreciate it.
Mr. President, you made an announcement about Venezuela today. Some administration officials told reporters on a conference call that all options are on the table. Are you considering a military option for Venezuela?
We're not considering anything, but all options are on the table.
Does that mean you're considering those?
Which is,
military
all
options?
options, always, all options are on the table.
And
Mr. President, Nancy Pelosi just responded, and she said she will not consider a concurrent resolution to have you come to the House on January 29th to deliver the State of the Union. Your response to the House Speaker.
I'm not surprised. It's really a shame what's happening with the Democrats. They've become radicalized. They don't want to see crime stop, which we can very easily do on the southern border. And it really is a shame what's happening with the Democrats. This will go on for a while. Ultimately, the American people will have their way because they want to see no crime. They want to see what we're doing. Like today, we lowered prescription drug prices, first time in 50 years. They want to see that. The Democrats would never have been able to do that. So we're all working very hard. We'll have to respond to it. We'll respond to it in a timely manner. Thank you very much, everybody.
How likely are you to get a deal with China next week? How likely are you to get a deal with the Chinese next week?
China very much wants to make a deal. We'll see what happens. I like where we are right now. We're doing great as an economy. They're not doing very well because of the tariffs. But as you know, fairly soon that the deal that I made with them will come off. The tariffs will be substantially increased on China. They're paying billions of dollars to the United States Treasury. First time we've ever done that. First time we've ever had money coming the other way from China. It's always been a one-way street. But I have a very good relationship with President Xi, and we'll see what happens. But we're doing very well in our negotiation with China. One way or the other, doesn't matter. One way or the other, we're going to do well.
What's
He
your
says he's been threatened by you and Mr. Giuliani. He and his family have been threatened.
No, I would say he's been threatened by the truth. He's only been threatened by the truth. And he doesn't want to do that probably for me or other of his clients. He has other clients also, I assume. And he doesn't want to tell the truth for me or other of his clients. Okay, thank you very much, everybody. Thank you. Thank you.